Thanks, Acting Premier. Good morning. So as the Acting Premier said, we had 0 new locally acquired cases this morning, which is terrific news, and 2 in hotel quarantine, 51 active cases in the state. Only 24 of them are local now. There were 13,176 Victorians who got tested yesterday. That's clearly come down from the very high numbers that we had in weeks previously, but the message is still the same. If you've got any symptoms at all, even the mildest of symptoms, please come forward and get tested. That'll allow us to find any possible virus that is still out there. I do want to thank the hundreds of thousands of Victorians over the past month who have set the standard for testing numbers across the country. We're really at fantastically high numbers on average, and it's been really informative for me in my decision making as Chief Health Officer to understand really that the high testing gives that high level of confidence around what the true situation is. As outbreaks stand, we're at 98% clearance of primary close contacts in the city of Whittlesea, Port Melbourne and the West Melbourne branches of the outbreak. They're stabilising, but we're not all clear yet, and a strong public health response continues, particularly in South Bank in the townhouses, and Jerome spoke about our work at that site yesterday. We're testing residents in the higher risk townhouses of the complex every 2 days, and one of yesterday's cases was one of those individuals who was in quarantine there. And we're doing a round of testing of residents in the lower risk townhouses, and those results should be through the course of today. From all reports, the Kings Park residents are genuinely committed to doing the right thing, working with our teams to protect the state as well as their households across those townhouses. And we thank them for really everything they're doing, setting aside their lives to keep us all safe, just as we thank the 10,000 others who've done the same as primary close contacts. We're also looking north, obviously, to Queensland and New South Wales situation, and we've been working with our counterparts in those 2 states to understand the risks associated with those outbreaks. We've got 7 declared LGAs in Sydney as orange zones. They're the city of Sydney, Waverley, Woollahra since the 11th of June, and Bayside, Canada Bay, Inner West and Randwick since midnight on the 20th of June. If you've been in these areas since the orange zones came into effect, then you need an orange zone permit to enter Victoria. That means isolating on arrival, getting tested and awaiting your negative result. And if you're coming here from Sydney on an orange permit to go to our alpine resorts, my first piece of advice is really you should be considering non-essential travel if you're coming from those orange zones. My second piece of advice is you shouldn't be isolating up on the mountain. Please isolate elsewhere and get your negative result before you head up. On vaccines, 15,339 Victorians vaccinated through our State Commission services yesterday. 6,391 received their first dose and 8,948 their second dose. I do want to put this call out to Victorians who received their first dose of Pfizer in recent weeks, and I tweeted about this yesterday, particularly those who are eligible in the expanded age to 40, but also those eligible because of the work classification that they're in. We thank you for your enthusiasm, we thank you for leading the way and for setting an example, but the job is not finished. We need you to do it one more time. That first dose of Pfizer provides good protection, 60-70% protection, but 2 doses finishes the job. It's 95+% protection from severe illness and death with that second dose of Pfizer, so it's critically important to get that follow-up dose. There are still tens of thousands of people who haven't come forward for their second dose yet. It can happen between that 3 and 6 week period after the first dose for Pfizer, so there's still time to book, and please do. Last week we had 50,000 people hit the 3-week mark for their second dose, and 30,000 people booked. This week we've got about 95,000 first dose Pfizer recipients who will be hitting that 3-week mark, and around 50,000 bookings in the system as of yesterday. So please book today if you haven't already. There's tens of thousands of slots left in the booking system, so please go to it. It's really straightforward, especially if you've had that first dose booked already, to complete the job and get that full protection from the vaccine. Thank you. Thanks, Acting Premier. Certainly on the question of other jurisdictions opening up to Victoria, yes, some have, some not yet, and some, require the testing or the quarantine of Victorians when moving, which is a reflection that the risk hasn't disappeared in Victoria, and that's true. We've still got hundreds of people who are quarantining. We've got scores of exposure sites who haven't gone through their 14-day period to be expired, if you like. And we've got lots of tests that we still need to come through today and tomorrow. So we're absolutely on the right track. I also have strong expectations that we can go that next step for both Metro Melbourne and regional Victoria, and that we'll do it this week.
Do you have any idea what that'll look like though? There's a NBL grand final on Friday, AFL this weekend. People will be wanting to go to those games. Is that a possibility you're looking at, crowds?
It's a possibility, absolutely, and we're looking to do as much as we possibly can, and part of the, having these couple of days for that further assessment is to go as far as you possibly can in making those changes.
Can you understand people at home though that are saying, why wait till Thursday, why not now? We've had, no cases in the community that weren't isolating. Why not today or tomorrow?
For all those reasons I've stated, there are still exposure sites where people may have been. We follow up very closely those tier 1 exposure sites where we try and track down everyone who's attended a restaurant or an indoor site where people have had face-to-face contact, and we're clearing those individuals and they're in quarantine. But there are those tier 2 sites where people have had briefer contact, many of whom have come forward for testing, many of whom have seen that call out, but some of whom may not have. And the challenge in Sydney is the same. They're not about to lift restrictions even though they've listed all those exposure sites, because there may still be people who haven't seen those listings or who haven't gotten tested yet or who aren't isolating. So we've got a lesser challenge in Melbourne, but it's not completely gone. You will remember the case from South Australia was quarantined and all of the close contacts were followed up, but it was about 2 weeks later that further cases emerged in the community. So we've got to bear that in mind. We've got to run everything down, and I still expect that we can make those changes this week.
What would football crowds look like if we did? We saw the Geelong game on the weekend. They were sort of all bunched up and there was big parts of the stadium that had no one in it. Would we better manage that if we did do it this weekend in terms of spacing people out more?
Yeah, I have gone back to the public health assessment panel to really embed that, to make sure that that's happening across stadia. The spacing that occurred within the zone in Geelong was still reasonable. People as groups separated appropriately, but if we're using a bigger capacity, I'd like to see those zones spread out more across the stadia.
In terms of this Thursday, Brett, is there anything that makes Thursday special? A certain number of sites coming offline, a certain number of tests expected to be done by then?
No magic numbers. We look at all of those things. Obviously, as the acting Premier said, more people coming forward for testing just gives a greater level of confidence. Part of the issue about the original case in Wollert and then further cases popping up 2 weeks later was that there wasn't sufficient testing around that through that period. And so if we can get that high level of testing, we can have that greater level of confidence. I expect that we will clear the final cases in the City of Whittlesea and the Port Melbourne outbreaks in particular. The Arcare Maidstone outbreak is closed now. The Blue Cross site is stood down. Even the West Melbourne cases will get to clearance in the next couple of days. So lots and lots of positive moves, but no magic figure.
People who have weddings coming up this weekend, should they be tentatively cancelling those plans, or if they've got big crowds?
Look, it's very difficult for people to make plans when they haven't got those announcements yet. We will make them as soon as we possibly can. We will move as far as we possibly can, and so for people who do have weddings scheduled and they've got those numbers locked in, I expect good news for them in as much as being able to go further from where we're at currently.
Australia has shown us that when we ease out of restrictions, regional Victoria takes a further step and Metro Melbourne follows in the footsteps of its regional big sister. Is that something that we can potentially look forward to on Thursday, or is there a possibility that you can potentially go even further? I know it's a possibility, you can't foreshadow, there's no crystal ball.
So yes, both regional Victoria will move, Metro Melbourne will move. There'll be less of a difference between them because they're moving more substantially. So there will probably still be differences. And in the public event assessments, the assessment of a public event taking place way out in regional Victoria that's attended just by regional Victorians or overwhelmingly by regional Victorians will have a different risk assessment by the public events framework and the panel that assesses that. So there'll still be some differences, but there'll be less as time goes by.
Mentioned second doses, that you want people to come forward. Are you seeing people aren't booking in for their second doses and they're missing that time frame, or are you just concerned that they're not getting through to be able to book? What's happening there?
Yeah, I don't think people have missed the time frame yet, but I'm really keen to make sure they lock it in. So, when people are coming up to their 3-week due date, if you like, for Pfizer, we want to see as many bookings as we had those first doses given out. We haven't seen that at the moment. It's about half of what we would expect. It may be that some people have other commitments or are elsewhere and can't do it at the 3-week mark, and maybe they're going to do it at the 4-week mark. But we really would like as many people to book in. It gives us the assurance that those people are going to get that second dose, and we know how critically important it is to finish that course. That's the first I've heard. They'll obviously be discussed in detail at HPPC, and we'll get further information about the exact nature of those. We assess it every day. I'll assess it today as for any day.
Putting everyone who books their first dose in for their second dose at the same time to maybe alleviate some of those issues you were talking about. Why isn't that being done?
Sorry,
booking everyone who books their first dose and then book your second dose at the same time. Would that alleviate some of the issues you were talking about?
Yeah, look, I think that's happening now as much as possible. So people who book online will have that opportunity to book their second dose. The booking system hasn't been up for as long as some of those first doses have been given, especially for AstraZeneca, but that's all embedded in the system now, so that the prompts and the opportunity to have that second dose locked in are there now.
Just a question for the acting premier. Just before you go, Brett, sorry. Just some questions on the iCook foods. Did you ever see a report from Knox that said the woman from Knox Hospital didn't eat from iCook Foods?
Look, I can't comment, it's before the courts.
But
So
do you think that the business was closed unfairly?
I can't comment, sorry. I'd love to, I would really love to, I can't, it's before the courts.
Just one more question. There's some allegations that you misled the parliamentary inquiry. Is that true?
Again, I can't comment.
No worries.
And can I just ask you, just before we step away as well, about Bondi? There's quite a few new cases there. Is that going to be considered a red zone at any point? Are you looking at that as a red zone?
Yeah, look, I'll have to review today, and if we need to make it a red zone, I understand the difficulties in those declarations, but if we have to do it to protect Victoria, I'll make the call.
Here's the question for the acting premier.